Coffee and cancer. What science says. There is nothing more relaxing in the world for someone who enjoys coffee than sitting outside on a terrace or in their living room, watching a cloudy day, listening to music, reading a book, or watching a movie. Believe me, it's more than relaxing. And that's because coffee reduces the risk of depression by 30% if consumed in 2 to 3 cups per day. Although this is not yet fully explained by science, there are books and articles that support it, so it's worth trying. Coffee is one of the most widely consumed substances worldwide. It is estimated that the average person drinks at least 1 cup of coffee a day. I mean, it's part of many people's morning routine, starting the workday with a cup of coffee to avoid feeling sleepy or to stay awake during long study sessions. Some people also drink it to relax, enjoying a coffee in the afternoon. But for many others, it's a key part of staying awake and productive throughout their day. Some drink it to relax, others to stay alert. At the end of the day, it all depends on you. But could this harm me in the long run? Here's the main point. Sit down, grab your cup of coffee, and watch this video. We know that drinking coffee increases your heart rate and blood pressure, but this effect doesn't last forever. Even the American Heart Association has shown that this rise in blood pressure, along with that pounding heart sensation, only occurs in very short periods and is not likely to cause hypertension. In fact, recent evidence shows that drinking 3 to 5 cups of coffee per day may reduce your risk of developing high blood pressure. This is also related to the risk of heart attacks, since coffee increases good cholesterol, HDL, and decreases bad cholesterol, LDL. So really, you're taking care of your heart, but remember to take care of everything else too. Exercise and eat well. One of the most important factors about coffee is how you consume it. Do you add a lot or a little sugar? Do you add milk, cream, whipped cream, or similar things? All of this takes away the health benefits of coffee. So obviously, there's a golden rule here, which is related to the rates of overweight and obesity observed in people who often unknowingly drink coffee daily with sugar and cream. Even 2 cups can contribute to weight gain, so let me teach you how to make coffee. First, pour water into the coffee maker. Then add the coffee of your choice, 1 tablespoon for every 250 milliliters cup. Turn the machine on, and now comes the hardest part, waiting for the coffee to brew. Be mindful of the amount you add. Too much and it will be too strong. Too little and it will be too weak. It all depends on your preference. Finally, pour the coffee into a cup. No sugar, no milk, no cream. If you follow the golden rule of drinking black coffee with water, it provides benefits for insulin resistance. In fact, people who drink 2 to 3 cups daily reduce their risk of liver-based insulin resistance by 7%. Yes, the liver is also involved in glucose metabolism. Moreover, regular coffee consumption is linked to weight loss, mainly because it lowers ghrelin, the hunger hormone, and increases peptide YY, which promotes satiety. You're suppressing hunger and increasing fullness. Sooner or later, you'll start to lose weight. And beyond its impact on hypertension and diabetes, there's even more we can say about coffee. We mentioned earlier its effect on depression, which is well documented. But coffee also has several neurological advantages. People who drink coffee improve their concentration, motor skills, and mood, all thanks to caffeine and the overall pleasant feeling of enjoying a warm cup. And if we want to get a bit more scientific, studies show that people who regularly drink 3 to 5 cups of coffee lower their risk of several brain diseases like Parkinson's, Alzheimer's, and dementia, progressive conditions that can emerge in old age. Adding coffee to your daily routine significantly lowers your chances of developing these conditions. Here's a little secret. If you're planning to study, work, write, or do anything mentally demanding, I recommend drinking a cup of coffee beforehand. It can help you focus and possibly boost your creativity. But be careful. If you drink it at 3 a.m., you're not going to sleep, and it's much better to take an exam wide awake than to fall asleep and fail. Now here's a medical tip. Some people suffer from migraines or other types of severe headaches, and there are 1,000 possible causes. I'm not telling you to self-medicate, but caffeine blocks a compound called adenosine, which is responsible for many headaches. So, drinking a cup of coffee might relieve your headache. That said, some people are very sensitive to caffeine, and for them, it can actually trigger a headache. People with migraines often know which foods or substances trigger their pain. Wine, chocolate, caffeine, or sugar might cause it for some, but not for others. In short, each person with migraines understands what affects them and what doesn't. Still, ask yourself this: why does ibuprofen with caffeine help relieve headaches? One of the biggest myths surrounds the kidneys. What do kidneys have to do with coffee? Studies have shown that regular coffee consumption can be beneficial for people with chronic or acute kidney disease, conditions that directly affect kidney function. Most importantly, coffee may help flush out kidney stones, so your kidneys are actually healthier with coffee. In fact, patients with diabetes or hypertension can drink coffee too. There's nothing that prohibits it. But kidney function should always be monitored. You can introduce many things into your body as long as they're not harmful. But nothing can be done if your kidneys aren't working properly. So go ahead and drink coffee, after making sure your kidneys are functioning as they should by seeing your doctor. During pregnancy, drinking coffee isn't highly recommended, but a daily caffeine intake of 150 to 200 milligrams is considered acceptable. Just remember that many products also contain caffeine. It's also not recommended for children to consume caffeine, as it can increase anxiety, irritability, and nervousness. Now, one of the most striking facts about coffee is its relationship with reduced cancer risk: liver, pancreas, colon, breast, endometrium, and melanoma, among others. A meta-analysis that combined data from 16 studies found that any amount of coffee consumption was associated with a 40% lower risk of hepatocellular carcinoma, HCC, the most common form of liver cancer, compared to non-drinkers. Furthermore, with each additional daily cup, the risk decreased by another 20%. Another independent analysis showed that drinking 2 cups per day was linked to a 43% reduction in liver cancer risk. In the case of endometrial cancer, which affects the inner lining of the uterus, a study pooling data from 19 epidemiological investigations, over 12,000 cases, found a clear dose-response relationship. Those who drank more than 4 cups daily had a 24% lower risk. Similarly, another meta-analysis of 12 prospective studies found about a 30% reduction, and a review published in Nature showed a 12% decrease in those who consumed more coffee compared to those who consumed less. Finally, a large meta-analysis of 40 international cohorts found that habitual coffee drinkers have an 18% lower overall cancer risk. Observational studies also report positive effects on colon and breast cancer. All these findings are based on epidemiological evidence and cohort analyses, where groups of people are observed over time to understand how certain factors influence health. And although the results are promising, this video is for informational purposes only and does not replace professional medical advice. We do not recommend making health decisions without consulting your doctor. If you found this information interesting and want to keep learning how to improve your health naturally and based on scientific evidence, we invite you to subscribe to the channel. Hit the notification bell so you don't miss any of our upcoming videos. Share this content with anyone who could benefit from learning more about coffee and its potential health effects. Your support helps us keep creating useful and reliable content for you.